After turning 60, our bodies begin to send signals we used to ignore. One of those signs is itching. Not the usual kind from mosquito bites or seasonal dry skin, but a persistent, recurring itch in specific areas with no clear cause. Older adults often think of itching as just a skin issue, but medically, itching in certain parts of the body can be an early warning sign of serious underlying conditions. If we miss this stage, the consequences can be severe. The first area, and one where many seniors experience persistent itching, is the palms of the hands and the soles of the feet. It may sound harmless, but if you feel itchy in your palms or soles at night, especially when the weather isn't cold or dry, be cautious. This can be an early sign of liver and bile duct disorders, particularly cholestasis, a condition where bile flow in the liver becomes blocked. When bile can't reach the intestines, it builds up in the bloodstream and causes itching. People with this condition often don't have visible rashes, just a deep itch under the skin, often worse at night. And what's alarming is that many people with chronic hepatitis, cirrhosis, or even bile duct cancer experience nothing more than itchy palms or soles in the early stages. If you felt a deep, persistent itch in your palms or soles for more than a few weeks without any rash, don't wait. See a hepatologist, liver specialist, and ask for liver function tests, an abdominal ultrasound, and liver enzyme screening. Early detection could save your life. The second area that needs special attention is the back, especially the mid-back and the area just below the shoulders. In older adults, this area often goes unnoticed because it's hard to see. But if you or a loved one frequently experiences itching in the back without visible bites or rashes, kidney issues should be considered. When the kidneys no longer filter blood efficiently, toxins like urea and creatinine build up in the body. This can lead to a condition known as uremic pruritus, or itching due to kidney failure. This type of itching usually occurs at night without any rash and tends to spread, but often starts in the back. Another important sign, scratching doesn't relieve the itch. The more you scratch, the more uncomfortable it becomes, sometimes leading to skin damage or bleeding without any relief. This is a dangerous sign that your excretory system may be in trouble. There have been many cases where chronic kidney disease was only diagnosed because the patient went to see a doctor for itching. If you have high blood pressure, diabetes, or a family history of kidney disease, back itching may be more than just a skin issue. It could be a silent cry for help from your kidneys. Please share this video with anyone suffering from unexplained itching. A small action like this could help someone detect a serious illness earlier than even a blood test could. The third area of itching, often overlooked but deeply concerning, is the scalp. Scalp itching in older adults can result from various causes, such as dandruff or seborrheic dermatitis. However, if you don't see any dandruff, there are no red patches, and the itch persists for several weeks, special attention should be given to hematologic disorders, particularly blood cancers like lymphoma or leukemia. Itching related to blood disorders often occurs without any skin lesions. The patient feels a persistent generalized itch, sometimes on the head, neck, or back, but the scalp is a particularly common site. This type of itching doesn't improve with shampooing and isn't related to hair products or hygiene. That distinction is key. One known mechanism is that malignant blood cells release cytokines, inflammatory mediators, which affect the nerves in the skin, creating a sensation of itching without any visible cause. That's why some people experience persistent scalp itch, only to be diagnosed with acute leukemia or lymphoma months later. The itching can also appear before any other symptoms, such as swollen lymph nodes, fatigue, or weight loss. So don't dismiss this seemingly minor sign. If you're over 60 and frequently experience scalp itching without dandruff or redness, it's important to speak directly with your doctor. A complete blood count, CBC, checking white blood cells, red blood cells, and platelets, along with a chest X-ray, are essential first steps. At this stage, early detection can greatly increase the chances of successful treatment. The final area of itching, and one of the most easily overlooked, is the chest, particularly around the breasts and upper chest. After the age of 60, if you frequently experience mild to moderate itching in the chest area, Without any rash and not due to sweat or fabric allergies, it's important to consider underlying metabolic conditions, especially type 2 diabetes and immune system disorders. When blood sugar remains elevated over time, the tiny blood vessels under the skin begin to suffer damage. The skin becomes dry, loses moisture, and its natural protective barrier weakens, making it more prone to irritation. But more than that, the nervous system is also affected. In people with diabetes, neuropathic itch can occur when small nerve fibers are damaged by high glucose levels. The chest is particularly vulnerable because it contains many intercostal and subcutaneous nerves. The itching may be accompanied by mild tingling, burning, or numbness, but without any visible skin lesions. Some people with long-standing diabetes may also develop darkened, slightly thickened patches of skin around the chest or the back of the neck, a condition known as acanthosis nigricans, which signals severe insulin resistance. The important point is, many people have diabetes without knowing it, and only discover it after seeing a doctor about persistent chest itching, dry skin, or unexplained weight loss. If you've been experiencing chest itching for more than 2 weeks without any rash, unrelated to clothing or weather, ask for a fasting blood glucose test, an HbA1c test, and a pancreatic function assessment. These tests don't take much time, but they could help you prevent future complications involving your eyes, kidneys, or nerves. Don't let a small, persistent symptom turn into a serious consequence. Share your experience in the comments. Someone else may be silently suffering and still searching for answers. You've just learned about 4 particularly dangerous areas of itching that people over 60 should never ignore: the palms/soles, the back, the scalp, and the chest. They all share one common feature: persistent itching without visible skin damage and unresponsive to regular topical treatments. This often leads to confusion, neglect, or incorrect self-treatment, which in turn delays the diagnosis of potentially serious underlying conditions. Itching is not always a skin problem. In older adults, it can be the first signal from a weakening liver, declining kidney function, silently progressing blood cancer, or dangerously rising blood sugar. And if we wait until more obvious symptoms appear, like pain, swelling, exhaustion, or jaundice, the disease may already be in an advanced stage. You don't need to panic over every itch, but what's important is knowing how to tell the difference between normal and abnormal itching.